Thank you very much, Deborah. Jim, you're representing the field of professionals who directly are contending with incentives, the increasing complexity, the measurement issues, the need for reducing fragmentation that have all been mentioned in the course of the panel so far. What, from your perspective, are the greatest opportunities, barriers, and needs?
So let me touch on some, but first say congratulations to the Academy, the work groups that produced this paper. The final report is really meaningful and will be impactful, I think, for our nation. Not to mention also really like that it's published in JAMA, so that's good too. So here we are for the third time since 1993. We're in the midst of a really robust health debate in Congress. And I think just like before, we can say that the Academy, the health policy community, and we at the AMA began the debate with the shared belief that the status quo is unacceptable. We are spending better than $3 trillion in investing in health, and we aren't getting our return. The decline in life expectancy for certain population segments and ongoing health care disparities and trends have to be reversed. And if you think about what's lacking in this fragmented non-system, and you look at the 8 priorities that are listed in VitalDirections, you see that we're suffering from the lack of execution of all 8 of these priorities that VitalDirections mentions. It's not good for the nation's health. And I have to say, while we're looking forward in vision and lean, that at this point it's also important that we maintain the advances that we've had, covering pre-existing conditions, and although not the topic of today, coverage in general. And like the Academy and the authors of the report, we believe that the uncertainty surrounding the Affordable Care Act, what's happening right now in Congress, shouldn't derail really important other health reforms. The journey that we're on now from volume to a value-based payment system actually began before the Affordable Care Act, and it continues to this day, and it follows the enactment of the Medicare Access and CHIP Reauthorization Act, MACRA, that has been touched on today, a very heavily bipartisan, bicameral bill that was supported in Congress heavily and focuses on value in the healthcare system. So we think that implementation of MACRA will be a significant driver in delivery reform. And it's also a turning point in reexamination of the administrative reporting requirements that detract from face time with patients and add unnecessary costs. The one element of the 8 priorities is not measure everything that matters. It's measure what matters most, a parsimonious set. The authors of the Academy's report identify these 8 priorities, of which measure what matters most is one. And I have to say these priorities are just beautifully aligned with the AMA's mission, which is to promote the art and science of medicine and the betterment of public health. So I'd like to highlight some of the key areas of intersection. The AMA's concern, as were the authors, with recent reports of decreasing life expectancy for Americans, and in particular the relative contribution of the opioid epidemic to this trend. The AMA convened a task force that's working with officials at all levels of government to enhance prescriber education, increase the use of prescription drug monitoring programs, expand treatment capacities, and access to naloxone to save lives of individuals who have overdosed. The Medicaid program has been critical in helping states cope with this epidemic. Another is improving management of chronic conditions, which we view as difficult but low-hanging fruit to achieve the twin goals of better outcomes and lower cost. And for this reason, one of the 3 AMA strategic focus areas is dedicated to improving control of high blood pressure and screening of referral of individuals with prediabetes to community-based programs. Now, both of these actually go out into the community, and we are learning how to use community assets toward improving health, working with American Heart Association, but also the YMCAs, partnering with the CDC and 40 organizations in the state of Michigan in the area of prediabetes. And critical to this is how the information from this community outreach does not become medicalized, which will only drive cost, but how one can partner with these community assets and have the information fed back into the health system in an organized, usable, and effective way. So we're enthusiastic about the emphasis in this report that places emphasis on empowering people and activating communities, very important to us. A relatively unsung success in this regard was last year's decision by the CMS actuary to credit diabetes prevention programs for saving money. And I think we have to do a lot more on this preventative front. Another example of intersection is the concern about inefficient aspects of healthcare spending. And one of the AMA's principles for healthcare reform is a call for greater cost transparency. And that's across the healthcare system, from insurers, pharmaceutical manufacturers, to hospitals, yes, and to physicians and all other providers. And transparency, we feel, is a starting point for development of additional policies to create greater efficiencies across the healthcare system. The last example I'll mention is that physician and other clinical staff time is a really precious resource. An enormous amount of time and money has been spent on this remarkable workforce. We conducted, in partnership with Dartmouth, a time motion study recently, published just last September, that shows that for every hour that physicians spend face-to-face with patients, 2 hours are spent on electronic health record, data entry, other desk work, with an additional 1 to 2 hours in the evening. And in fact, one of our meta goals is producing goods, services, and products that save physicians an hour a day that they can use to spend an hour more with patients. Saving an hour a day for physicians who spend 2/3 of their time doing administration right now, saving an hour a day would be the same as increasing the physician workforce in the United States by 100,000 physicians. So we think that this is incredible work, and the priorities are aligned. We're working with states, we're working with agencies like the CDC. We've opened an innovation studio in Silicon Valley that is connected but separately operating. And what we've learned from all this, not surprisingly, is everything we do, we need partners, and partners often have to have different interfaces. So for example, our partnership with the American Heart Association, we're creating a third interfacial unit so it doesn't get bogged down by the bureaucracy of the American Medical Association on one hand or the American Heart on the other, and yet can work in a partnered way. We've also created a medical school consortium of 32 schools where we're introducing skills such as health system science, team-based care as the third science in medical school, and thinking about big data, which unfortunately in our view right now is in healthcare is big data is also big bad data. So we are really delighted to work with National Academy, interact with partners, and try to bring these 8 priorities to life.